Hi, good morning everyone. Today I am going to present the topic History Collection under Nursing Foundation. So, history collection is an important part of nursing assessment. It helps nurses to gather complete information about the patient's health condition, lifestyle, and medical background. Accurate history taking helps in diagnosis, treatment planning, and providing quality nursing care. In this presentation, we will discuss the definition, components, and importance of health history collection. Definition. So, health history is a systematic collection of information about the patient's health in chronological order. It includes past and present health conditions, lifestyle habits, and family history. Health history provides baseline information about the patient and helps to nurses to identify the actual and potential health problems. So, proper history collection also improves communication between the nurse and patient and supports effective treatment planning. So, next we move on to the components of health history. So, health history has several important components. These includes biographical data, chief complaints, present history, past history, family history, personal history, environmental history, socioeconomic history, and then psychological history. So here each component provides valuable information regarding the patient's condition, and also it helps nurses to understand the patient holistically. So collecting all these data details ensures comprehensive nursing assessment and individualized patient care. So next we move on to the biographical information. So biographical information includes the patient's basic personal details. So these details include name, age, gender, address, occupation, education, marital status, and then diagnosis. So all this information helps to identify the patients correctly and understand the factors that may influence the health. For example, occupation may expose a patient to certain diseases, and education level may affect health awareness and treatment compliance. So next we move on to the chief complaint. So here the chief complaint is the main reason why the patient visits the hospital or any healthcare facilities. So it should be recorded in the patient's own words whenever possible. For example, a patient may say, I have fever and cough for 3 days. So here the chief complaint helps to identify the immediate health problem and guides further assessment and treatment. So nurses here should listen carefully and document the complaint accurately. So next we move on to the present health history. So present health history focuses on the current illnesses or problem experienced by the patient. So during assessment, nurses collect information regarding the onset, duration, severity, symptoms, and what are the aggravating factors and what are the relieving factors. So this information helps to determine the progression of illness and identify the problem, possible causes, and then accurate present history is essential for diagnosis and planning appropriate nursing interventions. So next we move on to the past medical history. So here the past medical history includes the information about previous illnesses, any surgeries underwent or allergies, hospitalizations, medications, and childhood diseases. So it helps nurses to understand the patient's previous health status and identify the risk factors that may affect present health. For example, a history of diabetes or hypertension may influence the current treatment decisions. Therefore, past history is an important part of comprehensive patient assessment. So next we move on to the family history. So family history includes information about illnesses and hereditary diseases present among the family members. It also includes family structure and health status of a parents, siblings and grandparents. So family history helps to identify genetic risk such as diabetes, hypertension, heart disease and cancer. So nurses may use a genogram or family tree to represent family health information clearly. So personal and environmental history. Here the personal history includes about the diet of the patient, sleep pattern, habits, exercise and elimination. Habits such as smoking and alcohol consumption can affect the health significantly. So environmental history includes housing conditions. So what about the ventilation, water supply, sanitation surrounding their houses and surroundings. So poor environmental conditions may increase the risk of infection and diseases. So nurses should assess both personal and environmental factors to provide holistic care. So next we move on to the socioeconomic and psychological history. In socioeconomic history, that includes information about income, occupation, education, and lifestyle. These factors can influence nutrition, healthcare access, and overall well-being. And when moved to the psychological history, this includes emotional behavior, mental status of an individual as well as a family, stress levels, and relationships with each others of the family members. So, understanding these, the patient's psychological condition helps nurses to provide emotional support and improve patient's care. So, good communication skills are essential during history collection. So, nurses should practice active listening and allow patients to express their concerns freely. So, open ended questions encourage detailed responses from patients. Empathy helps to build trust and comfort. Clarification ensures accurate understanding of information. Nurses must also maintain privacy and confidentiality during assessment to respect patient dignity. So, last, in order to conclude, in conclusion, accurate history collection is an essential part of nursing assessment. It helps to identify patient problems, support diagnosis, and guides care planning. Effective communication and observation skills are necessary for proper history taking. A nurse should collect information systematically and maintain confidentiality throughout the process so proper history collection improves patient outcomes and ensures quality nursing care. Thank you.